Good morning. I'm going to talk to you today about D3K2 as far as a preventative. And I'm going to back up a little bit. You know, we obviously have a crisis in this country and in that crisis, some things have become evident. I mean, you know, as a nation, we're incredibly unhealthy. 6 out of 10 adults have some kind of comorbidity. We know this condition has been very, very hard on a small percentage of the population. And so if we look at a condition that's unique to anything we've ever seen. Studies from around the world, 45 to 55% of people have zero symptoms, and then really 85% probably have minimal symptoms, not life-threatening. And then 15% of the population can have symptoms that to the last 5% become more life-threatening, things that we might end up in the hospital with and are severe. So one of the things that I think that has been lacking is we've talked about, social distancing, we talk about wearing masks, and we have lots of controversy about that, people on all sides. But one thing there's not controversy is that we know a certain percentage of population has a really affected. We know if you have diabetes, we know if you're obese, we know that if you have some kind of compromised immune system and that, those things that play roles on you. We also know that it's not the virus itself so much that's killing people, but the reaction to the virus. And there's something that happens when we get sick is that our body, when it doesn't matter if it gets cut or gets sick or something attacks it, it goes through a process that at first, before it can get control, it reacts. And so if you think about your immune system having two parts, and this is simple, and for you that know this more technically, but for just an easy explanation, one of the parts is that the body carpet bombs. It just goes in there, kills friend or foe, and it says, I need to just stop what's going on until I can get a really, really defined response, and that's a cruise missile. It comes in and it knows what it's looking for, it knows what it's attacking, and that. What happens is if this first part of the response lasts too long, then we get an autoimmune response in that, and we hear where we get clots in the lungs. You hear these weird things where we all of a sudden we have like somebody that might have lost an extremity, but it's a supercharged autoimmune system that, like we'd have an autoimmune disease, attacks itself. It's called a cytokine response and a cytokine response. And so the body cannot control its response and it gets carried away and now can cause tremendous inflammation within the lungs, tremendous amounts, because it's fighting a battle, but not real specific. So we know that inflammation is one of the things that drive it. We know that if we're compromised, and so what does diabetes do? What does obesity do? What is multiple diseases, the comorbidities? Because if we look at our young people without comorbidities, they're very healthy. I mean, there are studies around the world, and one of them said that under 19, they had not had a death with anybody that did not have a comorbidity, had some other health concern in that. So it's one of those rare things where young people are very much not affected. As we get older or we have comorbidities, we're very affected. And I think it's just curious that we continue to talk about how do we protect the people that are having troubles, and our whole process of protecting them is trying to not have people not so vulnerable get sick. And I think that we need to do two things: is absolutely not get sick, but not get sick in a way that it's not about just isolating ourselves. It's not just about masking, but what would we want to do? We heard before this virus is that one of the big things that drives the disease in this country is inflammation. So why aren't we talking about non-inflammatory diets? Why aren't we talking about things that would cause this reaction not to happen? And so one of those things, which is the simplest, easiest, and there were 5 great studies since March of this year, 2020, there's been 5 studies from around the world that have talked about if we take blood chemistries and we look at the people that do the best with this, any age, and the people that do the worst with this, any age, the vitamin D levels, if they have normal vitamin D levels, they're much less likely to go into this autoimmune response. If they have a lack of vitamin D, they're much more likely. So as we look at deaths, low vitamin D levels, we have higher deaths. High vitamin D levels, we have lower deaths. Countries like Germany, which has done a great job of for a number of people that had it to number of deaths. Well, vitamin D, they've been very aggressive in Germany. Promoting vitamin D to the population. They also did some interesting things with using vitamin C as a chelation, which means IV vitamin C with glutathione, trying to minimize this inflammatory process. Because if we can minimize it, I think it's not a coincidence that we look at a malaria drug that we've used for in inflammatory conditions, lupus, which is an autoimmune condition, rheumatoid arthritis, autoimmune condition. So when we look at that, even I asked the doctor about why we're looking at the Zithromax, which is an antibiotic, but why can that help with a lung condition? Because it's an anti-inflammatory to the lung as well as an antibiotic in that. When we look at some of the studies saying, people are inhaling steroids, well, what does a steroid do? It shuts down your immune system, tries to not have it overreact. And so we've used steroids for a long time when people have a flare-up of MS, a flare-up of rheumatoid arthritis, a flare-up of lupus. So if we're going to look at trying to shut down inflammation so it's not overly aggressive, we have lots of tools in our toolbox. We know we need to exercise. We know we need to reduce our stress. We know all these things in inflammation that. But one of the simple, most reasonable and cheap things is just, again, vitamin D3, K2. There's lots of different of companies that make it. It's a great product that's reasonable and cost effective. And I think that we just as a society have to look at, you hear more and more, we have to restrict kids from doing things because they could infect vulnerable people. But shouldn't we be putting an emphasis on how do we make vulnerable people less vulnerable? I mean, what are the things we can do? Because there's a tremendous amount of collateral damage if we continue to lock down healthy people and that. They themselves will become unhealthy. University of Wisconsin-Madison, our own state, 2 weeks ago released a study that 66,000 kids have more anxiety and depression since we locked people down, since they're less active, since they're interacting less than that. And again, I understand we want to protect people, absolutely. But protecting people is also telling them how to take better care of themselves. And I had a talk with a gym the other day, and they're so excited to be open again. They're so excited to be functioning in that. But they were frustrated that why did we leave liquor stores open? Why did we leave things where unhealthy things we left open? That we closed down gyms when we know that when people move, and he said, we have people come to the gym all the time that have brain cancer, that have some kind of autoimmune condition, they have degenerative joints, they have rheumatoid arthritis, they have lupus. And when they move and take care of themselves, when they're actively engaged in their health, they do better. So I think we just have to really, and all of you I'm asking, think about what you can do to make yourself less vulnerable. And if you feel a mask does a good thing, but then also know that lots of studies are saying, well, masks can falsely make you think you're safe, but really, don't you want to do everything you possibly can do? We know for sure that eating better can help you. We know for sure that moving well can help you. We know that for sure that having healthy social interaction can help you. We know that nutritionally that we can help you. And again, 5 different studies from around the world since March have absolutely said D3K2 is one of the things that should be a necessity. And when we see some of the countries out there doing better, or even one of the studies looked at where we had deficiencies, when a population has a deficiency of D3 across the population, they've had higher death rates. And when we have better D3 rates, we have lower death rates in relationship to the population. So I just want to talk today a little bit about D3K2. What they're suggesting is that you would take, if you do not, you can certainly go in and have a lab test for D3. Almost everybody in the United States is deficient in D3. We know that from studies. That's not something we know that almost everybody is. So if you don't want to pay for the lab test or don't have access or don't have the money, I sometimes say, well, D3 is safe, certainly safe at safe dosages in that. The study that I liked a lot said take 10,000 units, international units, to 1 or 2 weeks, then drop down to or to 5,000 international units after that. We know from September to around April, we do not absorb vitamin D in the northern hemisphere in Wisconsin in this latitude. So in the winter, you might want to up it again. We also know that if you put sunscreen on, you minimize your vitamin D formation. So thinking about maybe we have to have a safe amount, 15 to 30 minutes, wherever your safe amount for your skin is, that sun exposure for a period of time, that helps us produce vitamin D. But if we have young kids that have very low vitamin D levels because we as safe parents lather them up with sunscreen before we put them out. They can't absorb vitamin D, and then they have a long winter not absorbing vitamin D. And in this, we've just been outside less. I mean, people are outside less. Our kids are inside more, using computers and technology, and outside less. So again, something simple. If you have any questions, certainly contact us at Boucher Chiropractic. But it's just a real simple D3K2. Think about what is D3. D3 is a form that gets it, and I tell people, and they understand it. D3 helps it really get to the hotel, the right place. K2 helps it get to the right room, because our body needs to be able to respond to inflammation at different parts of our body in different systems, and it will need D3K2 to help that response. So D3K2 helps it get to the right hotel, helps it get to the right room. And again, it's cheap and reasonable. As a nation, if we got our vitamin D levels in line, it would mean we'd have less people that were tipping over to that critical side, and more people that got it but survived it healthy without secondary symptoms happening in that. So thanks so much for your time today. If you have any questions, again, contact us at Bouch Chiropractic. But it's a way reasonable, preventable, and we're going to do a series of these, because I just think we should have a national program to say, how do we make the vulnerable less vulnerable, not how to remove healthy people that may survive the condition well, but we don't want them to get in contact with vulnerable people. And I think it's really been tough on our children, really been tough on our kids. You know, again, if you look at depression and anxiety, we led the world in that with our children already. And we have to take that into consideration when we're making decisions. And at the same time, we want to protect the vulnerable. But protecting the vulnerable has multiple keys. And one of them is, how do we make them less vulnerable by behaviors that they have? And again, correct exercise, correct movement, correct nutrition, things like vitamin D. We will talk about other products out there, but the big gun out there right now, and the research the best, is on vitamin D, K2. So thank you so much. Contact us if you have any questions. We'll talk to you soon. Bye-bye.